Hello and welcome to Let's Talk Climate, a webcast series from ecoAmerica, featuring dynamic discussions with local and national leaders offering diverse perspectives. Let's Talk Climate brings forth the latest thinking and best practices for building public support and political resolve for equitable climate solutions in the U.S. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica, joining you just outside of Washington, D.C. on Nacotchtank and Piscataway land. We are co-hosting this episode, Back to School, Nursing Leadership on Climate Solutions in the Classroom, with the Alliance of Nurses for Healthy Environments. Here to host this episode is Dr. Katie Huffling, Executive Director of ANHE, who will introduce our guests and jump into discussion. Over to you, Katie.
Thank you, Rebecca, and thanks to Climate for Health for hosting this discussion with us today. Joining me for Let's Talk Climate are Dr. Linda Mendonca, former ANHE Environmental Health Nurse Fellow and current President of the National Association of School Nurses, and Andrea Lapuz, ANHE Student Nurse Committee member and active member of the National Student Nurses Association. Thank you both so much for being here with us today.
Thanks for having us.
I wanted to start by asking you to each talk about your experiences talking about climate change and health with your organizations. Linda, how is the National Association of School Nurses approaching climate leadership?
So NASN just recently actually revised our environmental health position statement that we had, and really looked at it closely as to what's happening in our world with climate change, et cetera. And the position really is of the organization to protect and promote the health of all children, and looking at robust environmental health protections that really have to be in place, and looking at the inequities too that we do face that lead to environmental injustice, and that these really need to be eliminated. And we also on our website have a vast amount of resources and links, such to like the EPA and other nonprofit organizations such as yours, ANHE, the Healthy Schools Network, et cetera. So there are many organizations. So we do have those accessible to school nurses to use and utilize, and they're there on the website. And we really encourage that school nurses implement these things in their school nursing practice.
And thank you, Linda. NASN's been such a leader in addressing environmental health risks in children, and it's such an important component of having healthy children and healthy environments. So thank you so much for your leadership. Mm-hmm. And Andrea, can you talk about what informed your interest in climate change and how you found ways to incorporate it into your nursing education through the National Student Nurses Association?
Yeah, so I came into my BSN program. I just graduated, so I was definitely looking to—
Congratulations.
Thank you. Incorporate sustainability into my nursing practice, but I definitely just wasn't sure how I should go about that. And luckily, during my undergraduate program, I took a class called Politics of the Environment, where I got to learn and discuss a U.S. environmental policy from the last century. And I feel like that class just really widened my perspective as to how climate policy is really just health policy and how we can use that to promote and safeguard our own health. So I definitely wanted to take that and incorporate that into my nursing practice. And luckily, NSNA has the Population and Global Health Committee that definitely talks heavily about population health and health inequities. And that's actually where I learned about ANHE and became involved with the Student Nurse Committee. And now I'm a part of the Health Equity and Anti-Racism Leadership Institute. And I definitely think it's important in talking about this on the national level, kind of like how Linda was talking about how they're talking about it on the national level, because without this, I mean, I definitely wouldn't have been able to explore these interests. And there are probably lots of other students like me who didn't have these opportunities locally. So I think I'm just really grateful for NSNA and just national leaders, because it just sends a clear message that nursing students are passionate about this and that needs to be talked about more, especially in local chapters. And there is a community of like-minded people out there, but it just definitely takes some searching.
Definitely. And the Student Nurses Association has also just the school nurses have been real leaders in addressing climate change. I was at the student nurses annual meeting when they passed their climate change resolution a few years ago, and it was really exciting to see so many of the student participants just really excited about that resolution. And I think it passed almost unanimously. So that was really exciting. And just to build on what you were talking about, Andrea, we're hearing a lot about changes to nursing school curriculum that include climate change education and action. And so obviously from your experiences, that's happening. But are there other pressure points that you think we should be focusing on in including climate change in a nursing school curriculum?
Definitely. I definitely think the incorporation of climate change is very dependent on your nursing curriculum, and definitely being part of the ANHE Student Nurse Committee, I'm blown away with the kind of knowledge that people bring to the table in regard to the kind of experience they have in like their local public health sector and organizing in their universities. And I definitely think it's not the case with a lot of schools. You know, with a curriculum that's already jam-packed, it's kind of difficult to implement that kind of nursing education where planetary health and public health are at the forefront. And I definitely think there needs to be a push for nursing students and educators to not only speak about it, but also to make it a priority in providing equitable healthcare. And I think there is a little bit of hesitation because it doesn't directly correlate to, you know, how well you'll do on your NCLEX, your exit exam, the kind of skills you need at the bedside. But I think it just really complements the nursing profession well, because, you know, we're supposed to be advocating for patients and trying to provide equitable healthcare. And I think where it needs to like step up and ramp up is just to incorporate it into every class in your nursing profession, maybe do one or two here or there. But I think every field of nursing just kind of needs to take responsibility for their role in promoting climate resilience and equitable healthcare, and needs to definitely just be talked about not only in your public health class, but throughout one's whole journey in nursing school.
Yeah, I just want to add on to what Andrea was saying as far as, you know, taking things to the national level. And, you know, there are so many initiatives, for example, that you, Katie, are doing with your organization, that you really reach out, you know, to the Student Nurse Association, to NASN, to, you know, to wherever you can, right? And just to really pull in nurses. And it's all about increasing awareness, I think, too, and really, you know, educating nurses on this topic. And Andrea, you're absolutely right. The importance of this in nursing school education is, and that's another hat that I do wear, teaching, and really trying to incorporate that, and making students aware that climate change does impact our health in ways that happens. So.
And just to build upon that, Linda, you know, with NASN, you know, mostly working with nurses who've already graduated, like any thoughts on how we reach those nurses that are already in practice to educate them around climate change and health and actions that they can be taking in their practice?
Yeah, I think anytime you want to introduce something new to somebody in their practice, making it relevant to their practice, because as we know, this topic can be related to no matter what nursing practice area you are in, but particularly in school nursing, you know, again, like I said, we've really been trying to increase awareness of school nurses, but looking at the school's physical environment, I think, is one way to really get them involved. And as you know, with this pandemic, we've received a lot of attention around the school's physical environment, around ventilation, right? So here's an opportunity. But school nurses, you know, also monitor the whole school environment as well, all the issues around that. You know, they can support that by looking, you know, for example, with asthma, they may be monitoring for mold, you know, issues around indoor air quality, for example. And so we know that climate change has been influenced by our natural disasters that are happening, floods, wildfires, et cetera. And these disasters are impacting our school environments. And so I think if we can reach out and kind of educate in that way, that they need to be really focused on their school environment and be up to date with disaster preparedness. And so kind of coming from it on that angle and telling them, you know, educating them on what these environmental hazards, if you will, due to climate change, how it will impact their student population and school communities.
Yeah, and I think having school nurses engaged in this can just it has such amazing potential for helping to prevent disease in our during childhood. So I think in addressing climate change in that way, it can be really powerful. Both of your organizations work with youth. Have you seen, we've seen tremendous youth leadership on climate solutions over the past few years. It's been incredibly inspiring. And what's your advice for nurses and other health professionals who want to further support youth leadership on climate solutions? And either one of you can answer that first.
Go ahead, Andrea. You can start.
I'll just branch off what you said earlier, Linda, about making it relevant. I think that definitely applies to my experience when I came into nursing school. I just didn't know how they really connected. And I definitely think as students, it's important to see that like nurses in the profession are talking about this and care about it. So I think if people can, look into their own community and find how to kind of make it relevant, I think that's really important. And someone, just maybe passionate about it, but isn't sure about how to approach it. So just, as educators, I think it's important to introduce students to these kinds of topics and just provide opportunities to learn and get involved in their local community. And I think like some ways I think would be important would be to like having guest speakers at your school, like encouraging your local SNA chapter to hold events, doing like small campaigns here and there, collaborating with community partners, and even something as simple as maybe instead of doing a certain simulation in your nursing school, maybe centered around environmental health, maybe do a disaster preparedness course, like you said earlier. I think those are definitely ways to get students more involved in this topic just within their own nursing program without having to do a lot of extra things. And a lot of hospitals are definitely talking about how their institutions can be more sustainable and equitable. So even just talking about it will be beneficial for students to build up kind of their own values surrounding how they feel about sustainability. And I can even help them choose, the kind of field of nursing they want to go into when they graduate.
Yeah, so as far as the K through 12 world, I think there's, so many opportunities to involve students, right? And again, getting their perspective, bringing them on as advocates and teaching them about advocacy and how, it's their school buildings and their school environment and their future, right, around climate change. And so I think reaching out to whether it's a student union or a high school group or middle school, and actually a couple of examples are a high school student union actually was advocating for the indoor air quality in their school and working on that issue. And then an elementary school 5th grade class was working on compost and food in the cafeteria, and went to the landfill for a field trip. And so it's just getting them interested in these topics and early, like kindergarten, right? And so that's what we can do in the K through 12 space with that.
Linda, that makes me think of just what can be so great about engaging the K through 12 age group is, when they learn about these things, they bring it home with them. Like, I just remember when recycling first became more widespread, it was like the kids learning about recycling in school and bringing it home to their parents. So it's just a really great way to exponentially increase folks that are working on climate change.
Yeah, it's in a way to engage families as well. Exactly.
Mm-hmm.
And you can even bring it in as an education thing at a parent meeting or something as well. So
definitely. One last question. We're starting to run low on time here. Andrea, how do you think we can use what we know about climate action to build health equity?
Yeah, so definitely just keep listening to the needs of communities that are made vulnerable by climate change. And definitely, as someone who just recently graduated, I would love to have more encouragement and empowerment from my educators and like my nursing school administration, just to be able to take action in my own community through community organizing. And, you know, if you're a student in nursing school, talk to nursing students around you, try to build up a community of people who are like-minded and want to take action. You can even write a call to action to your own nursing school. And just, it's important to advocate for those policy changes that promote healthy living and provide individualized care that connects people to appropriate resources in their community and that address their needs. So definitely taking any sort of climate action, I think, definitely leads us to health equity, and they're intertwined. And I definitely think people just need to see that.
Linda?
Yeah, so I think education is really a key to all of this too, and really trying to increase awareness wherever we can and educating, you know, populations of people. So doing that, you know, will help to make people become advocates and to care about their communities that they live in, work in, and play, you know, looking at all of those social determinants of health. And so the more people we can get involved in that, I think we do need work at the policy level. Then that's a huge, can be hard and it takes time, but you know, equity is so important. And if we don't all work together to try to achieve that, you know, it's going to take even longer. So, you know, working together as a team is what we need to do and educate.
Definitely. Well, thank you so much for taking time out of your busy schedules to talk with us today. It was so great talking with you. And with that, I'm going to turn it back over to Rebecca to close us out.
Thank you.
Thank you, Katie, and to the Alliance of Nurses for Healthy Environments for hosting this episode today, and to Linda and Andrea for being such wonderful guests. The examples you provided of students acting and how and where to include climate change and advocacy in the nursing curriculum was really powerful. So I just want to invite everybody who's listening, everybody tuning in, current nursing students, current K-12 students, parents, you know, please engage with us online with the hashtag Let's Talk Climate. Continue this conversation in your community, in the online community, and be sure to subscribe and follow us on our social channels for the latest thought leadership, resources, and episodes on climate action and advocacy. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, and get active. See you next time.